everyone. I'm excited to spend some time with another one of our advisors today. Doctor, to start with, could you tell us a bit about yourself and introduce yourself, please?
Sure. My name is Hirshel Kahn. I am a dermatologist and dermatopathologist. I've been in practice in clinical dermatology here in New York City for 22 years. I was originally born and educated in South Africa. I moved to New York in the late 80s and did residency here at Mount Sinai Hospital. Following that, I went into clinical practice, and I've been doing that ever since.
Great, sounds good. So, doctor, tell us about some of the challenges in healthcare you might have faced, especially related to digitization, electronic health records, or any other areas.
I've been using electronic health records for about 10 years now. I have specific experience with two different systems. As with anything else, there's pros and cons to everything. I think, the pros of electronic health records are obviously the universality of it, the easy access from multiple different points, the accuracy and the legibility of records. The negative is that it's much more time consuming. I think especially my generation, who didn't grow up typing on a keyboard or using your thumb to type into a little device, it's definitely a slower way of recording and documenting patient findings than just handwriting on a sheet of paper. And I think with the reimbursement changes, with insurance companies cutting back, with the need to balance volume of patients with good medical care at the same time, and wanting to speak to patients and spend time, adding an extra time-consuming requirement makes it very stressful.
It's interesting you mentioned stress and time-consuming, because there's been numerous studies that blame electronic health records for physician burnout. Do you agree with that? Do you see that happening?
I can absolutely see that as the cause. Especially in the beginning, when we transformed practices from paper records and just handwriting to electronic, I would spend at least 1 to 2 hours extra after hours catching up on all the records, and trying to write efficient notes, or should I say type efficient notes. So I would literally get home 2 hours later every day, and that's 2 hours more of work-related time, 2 hours less of recreational, relaxation, and family time. And so I definitely think that could be a major contributor to physician burnout.
What are some of the improvements you'd like to see? Like, what are some of the things at the top of your mind which we could do to alleviate that, to make it easier for doctors?
I mean, I think a lot of, certainly some of the requirements in terms of electronic medical records are also more restrictions that have, or requirements that have been put in based on, governmental requirements. So that would probably vary from state to state and also from country to country.
Right.
But I do think that, increasing efficiency of electronic medical records could probably be done with with implementing a device, which I'm sure is available, but at a great cost, where you could talk and it would automatically type out your
audio
note.
transcription.
Audio transcription. I think that would be a huge time-saving benefit. But there are also great things about electronic medical records, and I feel like over the years I've become more efficient at it, and to the point that I can barely write a note now because I've forgotten how to write and how to use a pen. But it's specific things like certain electronic medical records will, with e-prescribing, be able to notate whether a medication is going to be covered by that patient's insurance, whether a generic is required. Those kind of things are things that could be helpful to speed up efficiency.
Sure, I think those are important things. So one you talked about, I think audio transcriptions improving rapidly. And then the other one you talk about interoperability and integration. So if the system's more intelligent and it can make out of this drug is already covered by the insurance, so not that will add a lot of efficiency.
And then there's different systems have different fine tunings. Again, I mean, it would be helpful, I guess, in a country like this, to try and more universalize all the different systems we have. But sometimes that also takes away the competitiveness of different systems, which then maybe improves them.
Sure. So now we talked about the Universal Health Information Network. I know you spent some time studying it up as well. What are your thoughts on some of the concepts we shared regarding the UNHIN and a global internet for health information?
I think it's an amazing concept. I think the most interesting thought about the concept is the patient being responsible for their own healthcare records and their own healthcare device, as opposed to an institution or an office or a hospital owning that. So I think that's an amazing concept.
Sure.
And I think the fact that a patient is empowered to be able to provide that to a medical facility when necessary is going to definitely impact the level of their health care.
Right.
As they go from place to place or travel from country to country.
Right.
Accessibility is amazing.
Sure. And if the patient is able to update at least the demographics or some of the key information about themselves, do you think that'll take a bit of the burden of documentation or ease it on doctors as well? Or at least if they're able to...
Absolutely. I mean, if a patient gets admitted to an emergency room, unable to give accurate information about their history, it could take hours, days, or even weeks for the facility to be able to get accurate information. There potentially could also be repetition of tests, blood tests, imaging studies, biopsies that would need to be repeated if that access isn't easily available. Patients aren't always able to communicate their histories. They often don't understand results. They often have inaccurate understanding about it, and they often are unable to even give a list of their medications or what they're taking them for. Patients may also be not completely conscious when they put into a certain medical facility. And so these things would be incredible in terms of universalizing and saving time and saving effort on the part of a doctor or a hospital that's accepting that patient.
I'm glad you mentioned some of those things because having protocols on this network for emergency care, for physicians being able to access information when a patient can't provide it or is not fully conscious, is a very important part that we are building into it. It also leads nicely into the next question because What I wanted to ask you is, what are some of the things which you feel we should keep in mind? Some of the most important things while creating this global internet for health information.
I mean, in my mind, I don't understand blockchain
Sure.
and systems that provide good confidentiality, inability for breaches and for loss of that kind of confidentiality.
Sure.
So to me, security. That would be the whole security thing.
Sure. Absolutely.
And I assume that this system and method is very effective in preventing that.
Absolutely. In fact, on the security protocols, we are looking to strengthen it so much that a lot of features of HIPAA would become obsolete. So not only it's not just about implementing it, they would literally become obsolete. You won't have to worry about that. For example, on the UNHIN, if someone's running a node and there's health data on it, it would be mathematically and computationally impossible for them to leak the data, as opposed to having a contract with them. So, and that's one of the areas we're really excited about bringing over a period of time into the UNHIN.
That could ultimately almost get rid of the need for different electronic medical record systems?
Yeah. That's a good question as well. So here's the thing, right? So in the healthcare world, when we say electronic medical record systems, we actually mean a group of different systems. If a hospital has a management system of their own, or a clinic has a management system which is managing their business processes, that's something they would keep. Basically, if they've invested in that, that investment remains. That health hospital management or practice management system would connect to the UNHIN and have interoperability be solved completely.
I see.
On the other hand, in low resource settings where they haven't invested in or they don't have an EMR, they could log into the UNHIN and use its cloud-based EMR, right? So it caters to both, because it's kind of not logical to think about people throwing away their investment. Because they work really hard.
So it's a way of keeping smaller systems highly operational, but being able to incorporate it into the bigger system.
Yes, and get rid of the interoperability problem once and for all. Make it more patient-centric. Give patients their data, right? And also make it a playing field which is not competitive, in the sense vendors don't have to go at each other, because different any and every EMR or hospital system should be able to connect to the UNHIN. It literally is like the internet, right? So vendors don't have to compete with each other to connect to the internet. All of us can, right? Keep it in that way.
So it's really it's a brilliant concept. The whole thing is a brilliant concept. And I know, just, this is a private dermatology office. It's not like we have patients, being treated for transplants or major surgeries, where I've read about systems where patients, they've researched and found that patients function better at home instead of in prolonged hospital stays, things like that. And this certainly would encourage that kind of management of chronically ill patients.
Absolutely.
But even in a relatively small private office dealing with dermatology, we often have situations where I can't really treat a patient because I don't have access to their previous biopsies or their previous ultrasound.
Right.
And they have to leave and come back a week later with the reports and things like that. So even within a small localized area, something like that would be very helpful.
Yes, absolutely. Well, Doctor, thanks a lot. Thank you for spending time with us, and thank you for sharing your thoughts. They're very valuable.
And that's it?
Yes, that's it.
Wow.
Thanks so much.
Thank you.
All right.